Hi, everyone. Welcome to Viral Vitals. My name is Ewelina McDade. I have been an ER nurse for 17 years. This is Dr. Michelle McDade. She has been an ER physician for about 20 years. So today we are launching our first topic of discussion, and it is pediatric fever or fever in children.
So this is a very common question that we get. We're just coming out of winter and a lot of kids are sick, and understandably parents get really worried and they're not really sure if they need to worry or when they need to worry or when they need to go to the doctor. So we were going to sort of talk a little bit about those things. We're going to start with a disclaimer that this does not make up for you seeing your own doctor or your own child's doctor. This is just from our experience for your knowledge base and entertainment. We do not assume any liability. We are not Dr. Google. All right. So we're going to start with that.
So let's just launch right into it. So is a fever dangerous?
Yeah. So we sort of, as doctors, think about fever almost in two categories. There's fever at about 2 months and older, because at about 2 months you get your first set of immunizations. Your immune system is stronger. You're sort of you have a different ability to fight infection and fever. And then under 2 months is a little bit of a gray area where actually we do worry more. So for purposes of this discussion, we're going to talk about kids who are otherwise healthy, not premature, over 2 months old.
And immunized.
And immunized, yeah. And, not to get political, we know we've all gone through all of the COVID and vaccines and whatever, but there is a huge difference between children that are immunized and children that are not immunized, because before immunizations, when kids had fever, the lists of, bacteria and germs that could cause illness was much, much longer and much, much deadlier, to be quite frank. And immunizations has just changed that dramatically. So we're sort of in a different world now, if that makes sense.
Yes. So over 2 months and immunized, is the fever actually dangerous to the child?
Yeah. So fever is not dangerous. If we're talking about this otherwise healthy, over 2 months immunized age group, it's not dangerous. Fever makes a kid feel miserable. They don't really want to eat or drink. They don't feel good for sure. But in terms of danger, like, is it going to cause brain damage? Is it going to, do something bad? It is not dangerous in and of itself. So we do want to treat fever simply because if you treat a child's fever, they'll be less miserable. They'll drink. They'll stay hydrated. They'll just feel better. And you'll feel better just seeing them look better. But it is not dangerous.
All right. And before we carry on, let's just talk about what temperature is actually a fever. So 98.6 is our regular temperature. The fever doesn't start technically until it's about 100.4 degrees. So, my kids like to take their temperature, they see 99.2 and they think they can't go to school for the next 7 weeks. So that's not accurate. They really need to be over 100.4 to count.
Yeah, and there are people who think, somebody runs low or runs high, but really 98.6 is regular. That's where we all run, and 100.4 is 2 standard deviations away from normal. I think, in fairness, if someone's 99, 100, is something brewing? Yes, definitely. Are you going to start to not feel good? Yes, no doubt about it. But technically a fever is 100.4.
So what if it gets really high, though? 104. Parents see 104.
Yeah, so again, before immunizations, we did worry about the height of temperatures, but the height of the temperature does not equate to danger at all. It doesn't mean that it's more likely to need antibiotics or not need antibiotics. It doesn't mean, quite frankly, that a child is more or less sick. It doesn't mean any of those things. It just means that they're going to be a little bit more miserable, so certainly you want to treat it. In general, we treat fever with medicines like Motrin and Tylenol. Tylenol works great, but to be honest, you can only give it every 4 hours and it probably lasts only every 3. So you give it to your kid, they look good, 3 hours go by, they start to get miserable again, and parents start to worry like, they're getting sick again, and you can't dose it for another hour. Ibuprofen or Motrin, you can give it every 6 hours, but it lasts like every 5. So you still have sort of this window where your child doesn't have the medication to keep fever down. And there are ways around that for sure. You can either give the Tylenol and Motrin together at the same time. You can get it every 6 hours, both of them. They usually have some medication in their system, or you can alternate. You can give the ibuprofen and then 3 hours later give the Tylenol and then 3 hours later give the ibuprofen. So you always have something in your child and they will definitely feel better. And again, it isn't dangerous, but a kid who doesn't have a fever is going to drink. They're going to stay hydrated. They're going to look and they're going to feel better. And then you're going to worry less, if that makes sense.
Yes. And fevers really were a natural thing that occurred and occurs to battle different diseases or different viruses that we contract. And so really, is it better to treat the fever or do we let it go?
That's a really good question, because there is a benefit to one's immune system to not treat a fever. You're right. You know, in the caveman days when we didn't have medication, we know that raising one's body temperature helps ramp your immune system. It helps fight infection. And actually studies show that if you don't treat a fever, a child will be sick a little bit less long. They might be sick instead of 5 days, it might be 4.5 days, for example. My opinion as a doctor and as a mom is that I would rather give my child Tylenol and Motrin, have them not be miserable for those 4 or 5 days and have them be sick for 5 or 6 hours longer. I don't really care if it's 5 or 6 hours longer. I'd rather have them not be miserable for those days. But there is an immunologic benefit to letting a fever go that we are suppressing, but I think it's sort of risk benefit. And I think in the modern world, in the modern age, I think it's sort of fine and kind to go ahead and treat that fever.
So in the ER, we have definitely seen kids with seizures from their fevers. Can you comment a little bit on that?
Yes. So that almost goes back to the fear of, what happens if a fever gets too high. But the truth is a seizure from a fever can happen to any child under 5. In fact, we call it a febrile seizure. It's nice when we name things that are called by what they are. That is something that has nothing to do with epilepsy. So if a child has a seizure from a fever, they are no more likely to grow up and be epileptic or need seizure medicines or anything like that. It is truly just as one's brain is growing and the synapses are not sort of close together enough, as the height of a fever goes up, they, for whatever reason, are more likely to have a seizure. And I will tell you, it is super scary to see. Definitely every parent freaks out. I've even taken care of children of physicians who know that a febrile seizure is not dangerous, because it isn't. But it's super, super scary to watch for sure. But it is not dangerous. Nothing bad happens even from a febrile seizure. You don't get brain damage. You're no more likely to become epileptic. You're not going to have low oxygen dangerously, nothing like that. In fact, in the ER, we don't even think about treating a seizure from a fever unless it's lasted 20 minutes or longer, which is very unusual, almost never lasts that long. And the truth is, if you are a child who is susceptible to febrile seizures, you can get that seizure at any height of the fever. You could get it at 100. You could get it at 104. You could get it at any height. And the treatment is to treat the fever. But the truth is unless you're psychic and can predict the fever coming on before your child even gets it and get Motrin, Tylenol in them before they ever even start to go up, which you can't do, because even though we're miracle, wonderful, doting parents, we're not psychic. If your child is someone who's going to get a febrile seizure, they're going to get it as this fever goes up. So you have to do your best to not freak out, treat the fever, know that it's going to be okay, and kids grow out of it by the time that they're 5. So it's sort of what will be.
That's a great explanation. So how many days can a fever last before we really start to worry?
Yeah. So with immunizations, most of the fevers with kids are associated with what we call upper respiratory symptoms. So that's cough, congestion, runny nose, watery eyes, those kinds of things. So those really, they can go a long time. Those can go about 5 days before we even start to think has something else gone on, right? Because those are viruses. They're going to need time. Antibiotics are certainly not going to help. After about 5 days, we do start to wonder if something else is going on. We start to wonder, okay, has this cold maybe turned into something else? Does this child now have some kind of illness that needs antibiotics? So usually most doctors will do a cutoff of 5 days. Before 5 days, though, regardless of how many days of fever, there's really only two things that we worry about. One is if a child is just getting profoundly dehydrated, which hopefully they're not because you're treating them with Tylenol and Motrin, which helps them drinking. But if for whatever reason they're not able to stay hydrated, maybe they're vomiting a lot or they're just not drinking, whatever. Maybe you have a child with special needs who doesn't want to drink as easily, especially when they're sick. Dehydration is a reason to sort of do more and is a reason to get help. The second reason is any sign of sort of respiratory distress. And every kid with a fever breathes rapid. That's normal. That's part of metabolism. That isn't what I'm talking about. What I'm talking about is a kid who's really in distress. And to be honest, even if you're not a medical person, when your child is in distress from breathing, you'll know it when you see it. It isn't subtle. It's sort of a huffing and puffing, struggling, wheezing. It doesn't matter, honestly, if they have no fever. If they're doing that, somebody needs to see them immediately. So any respiratory difficulties, any profound dehydration, regardless of the days of fever, they need to be seen.
Yeah, so the good takeaway for preventing the dehydration, get anything into these kids. Anything. Popsicles, their favorite. They might start liking to be sick, so they can have multiple popsicles.
Right.
Anything really that you can get into them. I mean, even down to soda, even if, that's not typically what we're doing.
Right. And actually there's a lot of myths out there. A lot of people feel like when their kids are sick, they have to get Pedialyte. And Pedialyte's great if your kid likes it. But if they don't, give your kid whatever they like. Another big myth, don't give your kid milk when they're sick. Myth, if they like milk, give it to them. Anything that's wet or that melts and can be wet, totally counts. 100%. Whatever they want that's wet, that is going to get them to drink, give it to them.
Awesome. All right. So that about sums up our pediatric fever. We hope that this was really, really helpful for all the parents out there.
Feel free to ask questions if you have any. We'll try to answer them.
Yeah.
All right.
All right. We'll see you next time on Viral Vitals. Bye-bye.
Bye.